Toronto has its second lab-confirmed case of the measles this year. Toronto Public Health says the case is an infant who recently traveled and is now recovering at home. The public may have been exposed to measles on March 11th while attending a magic show held at the Agincourt Public Library between 1 and 5:30 p.m. And joining us live with this latest case is Dr. Vanita Dubé, Toronto's Associate Medical Officer of Health. Dr. Dubé, thanks so much for making time for us today.
Yeah, my pleasure.
So this is Toronto's second case of measles. It's also travel related. Do you expect these numbers to go up as more families return from March break travel, Doctor?
We do. We do expect to see more cases coming in weeks ahead of us as people have returned, are returning from travel. This second case was in an infant too young to be vaccinated before they traveled, did get measles while they traveled. And so we know that that is a significant risk here.
Yeah, I want to pick up on that. An infant who now has the virus, too young to be vaccinated. Is there any advice for parents with babies?
Yeah, if your baby is 6 months of age or older, they can receive the vaccine. Usually we give the vaccine at 12 months of age, but for infants who are traveling, they can get it as early as 6 months of age. And we do definitely recommend that because if an infant does get measles through their travels, at their destination, or when they return home, they can get quite sick.
Right. And we know the message to the public is if you were attending a magic show at the Agincourt Public Library on March 11th, you should know that you may have been exposed. We know an exposure has also taken place at Pearson Airport Terminal 3. What should you do if you've been exposed to measles?
Well, actually, if you were at the library that afternoon on March the 11th between 1 and 5:30, you should just, first of all, check your vaccination records and make sure that you are fully up to date if you were born in 1970 or later. And that means having had 2 doses of vaccine. And then you should watch for symptoms. So for the next 21 days from March the 11th, watch to see if you have fever, cough, white spots in your mouth or reddened eyes, and then that telltale rash that starts from the face and goes downwards. If you have those symptoms, then you should call ahead to a clinic to get tested.
And Dr. Dubé, I know you said at the beginning of this conversation you do expect the numbers to rise. Could we be headed for a measles outbreak in our city? And what is public health doing to prepare for that?
We certainly don't want that. And we know that when we have high vaccination rates, we can prevent those outbreaks. And we know among some of our cohorts, like in high school students, our measles vaccination rates are quite high. They were not impacted by the pandemic. But we do know among elementary students, some of them may have missed that 4 to 6-year-old booster. And that's really what we want to avoid, is getting an outbreak, especially related to a school setting. And so it's really, again, a call to make sure your child is up to date with their vaccination. Parents, also make sure you are updated. And then if you have symptoms, even if you didn't travel, consider seeking testing or medical care.
And finally, are you considering potentially setting up vaccination clinics in every single school in our city? Is that something public health is prepared to do?
We actually have vaccination clinics ongoing every week, community vaccination clinics that any student can attend. They can go to tphbookings.ca to book an appointment. We also actually are going to grade 7 and 8 schools to go back and give them second doses of those school-based vaccines. If there is a case associated with the school, we will certainly be providing vaccinations at those schools. But what we really want to encourage parents to do is actually to go to their primary care provider or to come to one of our clinics, because their child may need more than just the measles vaccine if they are not up to date.
Okay, we'll leave it there. Dr. Vanita Dubé, Toronto's Associate Medical Officer of Health, thanks so much for joining us.